Welcome, my dear students, to R.A.T.S in Pathology. We are visiting the R.A.T.S after a long break. R.A.T.S is for theory, game is for practicals. That much we shall remember. And the source of this particular article is Recent Advances 23, the Maternal Death Autopsy, a wonderful study by Sebastian Lucas. This particular picture from a Mayo Clinic shows a lot of information ranging from the instance to the emotion. And as mentioned earlier, this particular presentation of mine cuts across several topics which people shall be learning from. Having said that, there will be the changes in the various organs and organ systems which also shall be highlighted in the second half. Throughout, you find that tables, diagrams, and flowcharts will be supplementing or reinforcing our answers. Maternal deaths are not uncommon, even in the West. But there also, just like our country, autopsies are not commonly done unless it is at the behest of the coroner. And we should understand that there is an increase in the global causes of maternal mortality. The common instances are given in this. This again is a data taken at random instance from the net, but a wonderful piece of information. It can be because of hemorrhage, infection, eclampsia, obstruction, unsafe abortion procedures. It can be direct causes, indirect causes. Very wonderfully compiled. This we shall always have in mind. Think of the subheadings. The subheadings will take you to the answer. The causes of maternal death have been divided into direct and indirect. Direct, I would like you people to kindly by heart this particular table and reproduce. It can be because of hypertensive disease of pregnancy, which is preeclamptic, or HELP, hemolysis elevated liver enzyme with low platelets. So this is an abbreviation for it. Peripartum hemorrhage. This was shown in the earlier slide, and it includes abruption of the placenta, placenta previa, placenta accreta, rupture, spontaneous or iatrogenic, TRALI, transfusion-associated lung injury. Peripartum dilated cardiomyopathy, amniotic fluid embolism, and early pregnancy deaths can be because of ectopia or miscarriage or abortion. Sepsis is of importance. The list is continuing. It can be obstetric anesthesia as a complication, which leads to ventilatory failure. Also, a spinal infection leading to a shock or a meningitis. Air embolism, choriocarcinoma or hydatidiform mole, which can be implanted or developed further. OHSS, ovarian hyperstimulation syndrome, and AFLP, acute fatty liver of pregnancy. So these are the list of direct causes which we people must know. This is a flow diagram. You might imagine that it is out of context, but it is very much within the realms of our discussion. Diabetes, it leads to parasympathetic autonomic neuropathy, reduced awareness, and there is a hypoglycemia which follows. There is also sympathetic autonomic neuropathy, and along with hypoglycemia, this can lead to QT depression, ventricular arrhythmia, and sudden death. So why am I showing this flow diagram now? This is the case. A lady, a mother who has passed away. And this is called a death in bed syndrome. A death in bed syndrome is classically due to type 1 diabetes, and maternity is one of the causes for it. This is the list of indirect causes, which include venous thromboembolism, cardiac, systemic hypertension, stroke, arterial degeneration, epilepsy or psychiatric problems, other diseases including diabetes mellitus, cardiac arrhythmia, SLE, tuberculosis, and HIV. So these are the other causes for it, or the sub causes, which I would like you people to kindly memorize. Now, what is the role of an autopsy? In this case, generally, as is so, the autopsy is performed to find out what actually happened. And most of the causes are not predictable or preventable. The pathologist is supposed to leave the mortuary with information as well as the samples. So sampling will be of paramount importance. The author mentions that, for example, the various fluids we will have to obtain. Maybe the pleural fluid, peritoneal fluid, or aspiration from the GAT, etc. Also tissue samples, as and when the autopsy is being done, we follow the general dictums. And any area of suspicion should be sampled and examined. We will have to rule out a clinical or a medical negligence. Please do remember that in a case of maternal death, all cases are almost medico-legal. And even so, there is no hindrance from the coroner. The coroner does not restrict the pathologist. We will have to concentrate on the causes of direct deaths rather than circumstantial ones. So directly, what is exactly the cause of death in this particular patient? That will be the role of autopsy. Amniotic fluid embolism is of paramount importance. It is a question by itself. And here also, I would like you people to kindly make use of this exercise to recollect the pathology of amniotic fluid embolism. It can be in a form of solution or it can be in the form of suspension. This is of paramount importance as far as the topic is concerned. There can be the lanugo hair, vernix caseosa, fetal squamous, meconium, and trophoblast. These are important. The effects can be minor, unfortunately. I thought that there will be a mechanical obstruction because of this, therefore there will be a death, but it is not seemingly so. There are other mediators such as surfactant, endothelin, leukotriene, thromboxane, prostaglandin, thromboplastin, phospholipase A2, and PF3. So I would like you people to kindly go to the mediators and please recollect what they are. They cause the major effects that are associated along with it. They may lead to an anaphylactoid reaction or multi-organ dysfunction. Anaphylactoid reaction is different from anaphylaxis. Please go back to my topic on shock and find out the difference. As mentioned, what is actually the cause of death? It can be mechanical obstruction, DIC, hypotension, cardiac arrest, and pulmonary vasospasm. This is the role of immunohistochemistry in amniotic fluid embolism. This is the source of it, and the legend is given below. You find that the endothelium cells as well as the components of the meconium, lanugo hair, etc., or the squamous could be identified by means of immunohistochemistry. Cytokeratin is one of the markers that has been shown in the picture. Respiratory distress syndrome. This also I have covered for the undergraduates in R.A.T.S. It is worth visiting that particular topic because it is a little complex, but then easier to understand through R.A.T.S. Adult respiratory distress syndrome, disseminated intravascular coagulation, and ventilation hypoperfusion. So these are the important things. And in this particular table, the author has divided into cardiovascular, respiratory, hematologic, neurologic, and obstetric causes. Cardiovascular, we have already seen most of them. Hypotension is one. Respiratory, there can be a respiratory arrest, hypoxemia, tachypnea and dyspnea, respiratory distress, or perfusion absorption mismatch. Also, you find in hematological, there can be coagulopathy, disseminated intravascular coagulation, and hemorrhage. Neurological, altered mental status, seizures. Seizures themselves can lead to death, maybe aspiration, so on and so forth. Obstetric, fetal distress, uterine atony. This is again a very beautiful and a very simple picture which you people should memorize. Whenever there is an exposure of the fetal tissue to the maternal circulation, there is an activation of inflammation. You had seen the panel of mediators in the previous slide. It can lead to disseminated intravascular coagulation. This itself can lead to thrombosis as well as bleeding. Bleeding results in hypotension. ARDS, again hypoxemia, heart failure, hypotension. All of this either directly or indirectly can lead to neurological injury. So this is one particular beautiful chart which will definitely fetch you marks and pay you the dividend. There is another particular table that has been given called classification of maternal deaths. First, whenever you see a table like this, spend 1 or 2 minutes and analyze. There is a definition, there is a set of examples. Under the definition, the author has divided into direct cause, indirect cause, and coincidental cause. For example, directly, it can be related to pregnancy or to delivery. That is the definition. Indirect means it is not related to pregnancy, but it can be exacerbated or exaggerated by pregnancy or delivery. Coincidental, it is totally unrelated to pregnancy. So this I hope you people are able to follow. Directly related, not directly related, and purely coincidental. And these are the set of examples for it. This is a mnemonic that I had defined or designed rather. SEAT, for example, sepsis, eclampsia, amniotic fluid embolism, trauma. SAD, sudden cardiac death, AIDS, dissection of aorta. CATCH, it can be coincidental, accident, toxic drugs, cancer, homicide, or suicide. This is something that I had worked upon. Please benefit from it. What can be the differential diagnosis of sudden collapse in pregnancy during or after delivery? This will be the list of differential diagnosis that is given. It can be embolism, amniotic fluid embolism, air embolism, hypovolemic shock, arrhythmias, sepsis, eclampsia, arterial or aortic rupture, and SUDEP, sudden unexpected unexplained death in epilepsy. This is one. Repeatedly, he has been quoting epilepsy as one of the causes. And this incidentally is one. A healthy mind is the greatest treasure to find. I don't know where this quote came from. I thought I'll include it. This again is a very touching picture as such from Mirror Online. It is the mother and the child. And very sad to see that this particular picture has been taken by the father of the child itself, to note that the mother has passed away. To the world, you are a mother. To our family, you are the world. Beautiful one. I do not know how many of these people will be lamenting this in Ukraine. Life hurts a lot more than death. There is nothing wrong to know that this is the distribution of the maternal deaths in various things. So you people can boldly say that it is very common in the African countries, Afghanistan, etc. Low in Canada and the USA. And even in India, it is much lower. Australia, again, it is low. It is concentrating in and around Africa. Pain is so real, but so is hope. I hope you people are able to identify it. This was in fact kept as a slide for us during our MD exam. I am able to find the squames within, and of course the empty spaces indicate the alveoli. It is a lung, a case of amniotic fluid embolism, and this is the source of the picture. Amniotic fluid embolism, the answer is not complete. There are two phases of it, typical phase and an atypical phase of presentation. Typical one, that can be the cardiopulmonary collapse, there can be the coagulation disorder, multi-organ dysfunction. There can be distant complications such as neurological, both to the mother and child. This is typical. Atypical can be uterine hemorrhage, atony, consumption coagulopathy, ARDS, paradoxical amniotic fluid embolism, cesarean section related AFE. So these are the two things. So you find that there is a lot of overlap between the clinical and the pathological aspects in this particular topic. And this continues so. So you find that there is an amniotic fluid embolism, there is an embolus from over here, and it is entering the circulation, wherein you find that there is a left ventricular failure. Because of the failure, there can be a pulmonary edema. Again, there can be a vasospasm, etc. Patient can go in for hypoxia, and also an ARDS will be developing in the lung. Simultaneously, there is an activation of the disseminated intravascular coagulation with its rampant complications. So this is from this particular source. Hats off to them. Again, a very beautiful picture. I do not know the flow of ideas that emerge from it. You people can think. As I mentioned earlier, always the clinical and the pathological aspects go hand in hand. This is a clinical presentation. You will have to check for meningitis when the patient is alive. Check for the temperature signs. Examination of the breast. Examination of the respiratory infections as such. Uterus for a collection of any of it. And the vein should be examined for thrombosis. Always the fluid should be sampled wherever it is. Look for the lower leg vein, thrombosis, etc. So this is a general examination that one should have in mind. Try to superimpose on the direct causes for maternal deaths, in which you will be finding the various organs. This is what I told you people in the beginning. There is a second half of it. Let us see what is happening. In the brain, there can be a cerebral hemorrhage. There can be a aneurysm from it. So this has to be ruled out. Petechial hemorrhages can be present. It can be because of septicemia or disseminated intravascular coagulation. In the kidney, there is a cellular proliferation, and a beautiful term has been used: herniation of the glomeruli into the tubules. Beautiful. Let us see what it means. In the uterus, there can be fibrinoid necrosis or the infarction. That can be seen in the placenta also. Many a time we do see it in the placental examination. And this is the glomerulus. There is the proliferation, etc. There are areas of fibrinoid necrosis. These are the tuft of tubules which are opposed to it. Probably there can be a herniation of a bit of the glomerulus into the tubules. Fibrinoid necrosis, people do have in mind. And there is always nothing wrong to know this. What is this? The disseminated intravascular coagulation. This by itself is a question. If you students are familiar with those topics, you will be able to answer this. So there can be obstetric causes, non-obstetric causes, and these are the various ones. Most of them I have mentioned. I am not going to repeat them. Regarding the non-obstetric causes, it can be sepsis, trauma, organ dysfunction, leukemia, etc. This is not related to obstetrics or even pregnancy, but it is worth knowing this particular table so that it will be useful for you elsewhere, even if DIC is going to be a question for you. Transplant rejection, blood group incompatibility, etc. This is again a very, very beautiful picture that has been taken from the net whatsoever. So you find this is the normal placenta. This is the umbilical cord as such. So probably this will be the fetal surface. This is the maternal surface of it. So this is a uterus. There are some conditions in the placenta called as placenta previa. The placenta can be retained. Either of them can be leading to hemorrhage and disseminated intravascular coagulation. But there is another group of syndromes called the Creta syndrome. Creta means there can be accreta, which is adhesion of the placenta. Increta, partly this is accreta, it is adhering. And increta means it is partly infiltrating into. And percreta means through and through. It passes through and through. You people can imagine the complications. So this is the placental position. This is normal somewhere over here. It can be by the side or marginal. There can be a partial protrusion, or sometimes you find that there can be a total placenta previa. But this is an obstetric situation. And look at this one. This is probably the infiltration of the placenta into the myometrium. Many a time this can be mistaken for a choriocarcinoma, but then in a choriocarcinoma, you will not be finding the normal villi. So the presence of cytotrophoblast and syncytotrophoblast, very carefully we will have to look for the remnants of the villi. The veins, you can have a venous thromboembolism, and this can happen in a case of thromboprophylaxis. And the entire pulmonary artery also will have to be examined at autopsy. Cardiovascular disease, because of the weakening, there can be aneurysm. Berry-aneurysm is one, dissecting aneurysm is another. These are the set of veins which have to be examined to rule out any kind of thrombus or a source of thromboembolism. Indirect causes for maternal deaths. So this is the entire list which we should have in mind. And this continuing. This is again a very beautiful picture. The source of it, I confess, I have taken from this one. Due credit to them. And this is the particular one which I would like you people to visit if time permits. It shows the various veins. And then please do remember, anesthesia is the one that is unraveling. Just like pathology, it is a hero behind the screen. Cardiac disease, ischemic heart disease due to the lifestyle, obesity, prolonged QT interval, cocaine, and peripartum cardiomyopathy. All these are there. Robbins is one of the sources for the list that is given over here. And this is the dilated cardiomyopathy, wherein I am finding a distended left ventricle and the left atrium. Thrombotic thrombocytopenic purpura can be another indirect cause of death. Infections, indirect causes, of course. It can be bacterial sepsis, viral infections, etc. H1N1, tuberculosis, and HIV. Of late, COVID-19, it has been a horror for the general public as well as the pregnant mothers, many of whom had passed away because of it. And this is a painting that has been done. A big salute to the Corona warriors. And it has been from the Alzheimer's Society. Congratulations to them. Liver, there can be confluent areas of hemorrhage. In the liver, there is a condition called as fulminant hepatitis. Look at this one. I am finding a greenish pus. Liver normally, when it is going for cirrhosis, it will be firm. But in this, it is collapsing. I am finding a wrinkling of the outline. And on cut surface, there will be multiple pockets or even entire lake of purulent bile stain fluid. Fulminant hepatitis, it can be secondary to hepatitis or it can occur in conditions such as pregnancy. Peri or the postpartum hemorrhage, uterus after hysterectomy, it can be affecting the pituitary or result in a hypovolemic shock. Having said all that, it is the duty of the pathologist and the doctor to refute negligence. Imagine a situation where the mother passes away. Obviously, there will be an onslaught on the hospital and the doctors. What should the pathologist do? Discuss with the obstetrician, cardiologist, anesthetist, and the physician. Find out what exactly is the clinical situation. And you will have to release the autopsy report, which will be scrutinized by the coroner or the lawyer. Family member will be a member of the panel, and there will be an extensive inquiry review panel. This is what is going to be happening. Many of us are interested in corporate hospitals. Please be aware of this particular one. Someday we should be facing it, but then we should be having the courage to refute negligence on our part. In fact, we are trying to save lives, not take lives. What is the conclusion? The autopsy, it should be performed by a senior and an experienced pathologist, not anybody who passes by way. As much clinical and laboratory data should be obtained. It is a study as a whole. Blood sampling before evisceration. Retain the femoral venous blood for culture, etc. A senior person should supervise the entire dissection. And these are the structures you people will have to study in detail. Sample of all organs. Multiple blocks from these regions if they are found affected. And retain spleen in a bit of a freezer. So This can be used for later study. Coming to the end of it, life hurts a lot more than death. This is what I had mentioned earlier also, the why.